Hello, and welcome to our panel discussion on erythropoietic protoporphyria, EPP, phototoxic, light-triggered reactions, and systemic complications associated with accumulation of PP9. This video program is sponsored by Disc Medicine. The speakers are not employees of Disc Medicine, but have been retained to present on Disc Medicine's behalf. Today's speakers are Dr. Bruce Wang and Dr. Gail Ross. I'll let each of today's speakers introduce themselves. And Dr. Wang, let's start with you.
Hi, Josh. I'm Bruce Wayne. I'm a hepatologist and associate professor of medicine at the University of California, San Francisco, with a focus on inherited liver diseases. I run the UCSF Porphyria Center, which is the main referral center for patients with porphyria on the West Coast of the United States, and I run a research laboratory studying basic liver biology. I'm an active member of the NIH-sponsored Porphyrias Consortium, and I'm also a member of the American Porphyrias Expert Collaborative, serving on its board of directors. I have been a principal investigator on several clinical trials in porphyria, including the Aurora trial.
And I'm Gail Ross. I'm a dermatologist and an associate professor of dermatology at the University of Melbourne in Melbourne, Australia. I specialise in porphyria and I run the Porphyria Expert Centre at Royal Melbourne Hospital, which is the main referral centre for porphyrias in Australia. I've been an active investigator in multiple porphyria trials over the years, including the Beacon trial, and have published widely in this area.
Doctors, a pleasure to have you both with us. Thank you for joining us, and we're looking forward to learning more about the cause and impact of this rare disease, as well as hearing more about your experiences with EPP. Now, we should note that this video program is split into 3 video chapters. Chapter 1, Illuminating PP9, the cause of phototoxicity and systemic complications in EPP XLP. Chapter 2, Understanding patient health and psychosocial burdens of EPP. And Chapter 3, Advancing care for patients with EPP. In Chapter 2 of our video series, Understanding Patient Health and Psychosocial Burdens of EPP, Dr. Ross and Dr. Wang will explore the impacts to patient health and psychosocial burdens associated with EPP. It's now my pleasure to turn the presentation over to Dr. Ross. Doctor?
As we've noted, EPP is characterised by skin photosensitivity and severe phototoxic reactions that cause extreme pain.
And what causes these phototoxic reactions?
The phototoxic symptoms are due to the absorption of light by the accumulated PP9 in the vascular endothelium and surrounding tissues. As we can see in the diagram on the right, in the vascular endothelium we have these red blood cells loaded with excess PP9. Visible light can penetrate into these vessels, and this results in a photodynamic reaction, leading to production of reactive oxygen species and an inflammatory response. This can manifest as tingling, itching, burning, and progress to severe pain, swelling, and erythema.
Now, prior to developing a full phototoxic reaction, as was just described by Dr. Ross, patients may experience prodromal symptoms following sunlight exposure. These sensations typically present as itching and burning in the parts of the skin that are exposed to sunlight and serve as a warning for patients to retreat from the sunlight. However, as sunlight exposure continues, and the symptoms oftentimes can progress to the more severe, painful reactions as just described. In these photographs here, a full phototoxic reaction is primarily seen on the face and the hands. And to provide a real patient's perspective on this experience, I would like to draw your attention to the quote on the side. He was writhing on the floor in intense pain and didn't yet have words to explain what he was feeling. It was a look of pure terror in his eyes. This was from an EPP caregiver and is courtesy of the United Porphyrias Association.
So do all patients have the skin reactions you've just described?
Well, not every patient will develop a visible skin reaction, despite experiencing really significant pain from light exposure. And this is why EPP is oftentimes referred to as an invisible disease, because the associated severe pain and isolation is not always outwardly apparent.
So it sounds like the patient experience of EPP can vary depending on the individual. Dr. Ross, can you expand on that variability?
Sure. The age at which patients experience phototoxic symptoms can also vary, but the mean is around 4 years of age, with 39% experiencing symptoms before the first year of age. But sun tolerance will also vary from patient to patient, and factors that can affect this can include their PP9 levels, their geographical location. So we find the further from the equator, the worse it tends to be. Obviously, the season, so it tends to be worse in spring and summer and better in winter. And obviously, the weather conditions themselves. So many patients will actually say a cloudy day can be worse than a bright sunny day because the cues can be lost. Same with a windy day, they can sometimes lose the initial sort of prodromal symptoms. We also find there's something called a priming effect, which can take place where prior exposure to the sun will make the skin more sensitive to sunlight on subsequent days. And with prolonged sun exposure, many individuals with EPP end up with this thickened, leathery skin and scarring, which is a very chronic change.
So, Dr. Wang, can you talk us through the timeline from that initial sun exposure through recovery of any resulting symptoms?
Sure. The overall timeline is shown on this graph here. Now, while most patients develop prodromal symptoms within 30 minutes of exposure, the time to onset can vary from a few minutes to several hours in some people. But about 1 in 3 patients will report onset of symptoms within 10 minutes of direct exposure to sunlight. Now, continued exposure will then lead to a full phototoxic reaction, which will result in significant pain, and that can last for several days. It's important to note that this severe pain cannot be alleviated by opiates or any other types of pain relievers. Other skin-related symptoms can include temporary allodynia, pruritus, and increased sensitivity in the face, hands, and feet. The recovery from a full phototoxic reaction can take up to 7 days.
So, Dr. Wang, can you explain why hospitalization may occur for patients with EPP?
So patients with EPP may require hospitalization due to various complications. In a recent survey of 164 adults with EPP, 9% visited the ER and 6% needed hospitalizations within the past 12 months, with the main reason cited as pain from total phototoxic reactions or liver problems.
And what is the role of liver transplants in severe cases?
So for a small subset of patients, EPP can lead to end-stage liver disease, where a liver transplant may become necessary. However, it's important to note that a liver transplant isn't a cure for EPP. The underlying issue is the continued overproduction of protoporphyrin IX by red blood cells in the bone marrow. And this will remain unaddressed since the genetic mutation persists even after a patient has received a new liver. And this reality is reflected in post-transplant survival rates, which range from 47% to 66% at 10-year follow-up after liver transplantation.
Dr. Wang, thank you. Now, Dr. Ross, could you tell us more about how EPP affects patients' quality of life?
Absolutely. A recent survey of 197 patients, 164 adults and 33 adolescents, highlights the significant negative impact of EPP on overall quality of life. Phototoxic reactions are a major concern, with about 5 days needed for recovery and a high pain level of 7.6 out of 10. But beyond the skin reactions, EPP involves other serious comorbidities. About a third of patients experience liver or gallbladder issues, and over 70% report depression or anxiety due to the disease. Daily life is profoundly affected. 23% of adults miss work, a third of students miss school, and 63% of patients feel greater social isolation compared to the general population. These statistics paint a pretty clear picture of how EPP extends beyond the physical symptoms to affect mental health and everyday functioning.
So these data show a large percentage of adults with EPP report anxiety, depression, social isolation, and loneliness.
Correct. As we can see from these bar graphs on the left here, these high percentages really underscore the profound impact that EPP has on the patient's lives beyond the physical symptoms. And it's really crucial to address these mental health challenges in our treatment plans. We need to be proactive in screening for and managing these issues. The quote here on the right, seen here, brings this data to life and underscores the very real impacts of EPP on the patient's daily lives. And I'll read it here. This is from patient Kim D, who has EPP. EPP is like hell on earth. My dream is to just have one day, just one day, to feel what everybody else feels, to sit on the beach, in the sand, under the sun, and to not feel like I'm burning alive. If I could have that one day to actually feel normal and not have to go outside in the summer with all kinds of layers like I'm some freak that people my entire life have been afraid of because I am different. I wish for one day I wasn't different. If only I knew what the sun really felt like instead of worrying if I could live or die being outside for a period of time.
So we're seeing a large psychosocial impact of EPP on adolescents as well in terms of high rates of anxiety, depression, sadness, physical, social isolation, and loneliness.
Correct. These numbers are really striking. Over 60% of adolescents with EPP experience anxiety, and nearly half struggle with depression and sadness. This really highlights the critical need to integrate mental health support into the care of our patients with EPP. And again, we need to actively screen for these issues and offer appropriate interventions.
Many children with EPP also report frustration and disappointment due to missing out on outdoor activities, and 42% also missing school. Plus, this quote from a patient with EPP really drives home the emotional toll of this disease, especially during the formative years, and I'll read it out. I sometimes feel anxious because of my fear of being left out, or sad because I can't do the same things the other kids can.
So, Dr. Ross, how does the burden of EPP extend beyond the individual to the caregivers and families?
So, in addition to the burden on the patients themselves, it's significant that around 51% of family members report at least a moderate impact of EPP on the entire family's quality of life. And this suggests the need for healthcare providers to approach the management of the care of patients with EPP in the context of the entire family unit.
And the slide also points out that family activities, social lives, and emotional well-being are significantly affected. 90% of parents reporting frustration related to a lack of understanding regarding EPP, and they worry about the unpredictability of their child's symptoms. And the quotes from Briggs and James highlight the creative solutions and positive attitudes that families adopt. However, this doesn't diminish the real challenges they face.
Exactly. There's a need to provide resources and support to help families cope with these challenges. That includes education about EPP, includes access to support groups, and mental health services as appropriate. I think these quotes really highlight the strength and resilience of families, and we should really empower them with the tools to advocate for their loved ones and maintain their own well-being.
It's important to remember that each patient's experience is unique and that their needs will evolve over time. This necessitates a personalised approach to care, considering their individual symptoms, challenges, and goals.
So children are disproportionately affected by the psychosocial burden of EPP, and additionally, the impact extends beyond the patient to other family and their caregivers.
That's right. We need to be especially mindful of the emotional and social challenges faced by children with EPP and their families. Furthermore, regardless of light tolerance, phototoxic reactions can be exceptionally painful and take days to resolve, and light avoidance further limits daily activities. We need to offer comprehensive support that addresses both the physical and psychosocial aspects of this condition for both the patients and their support system.
So this now nears the end of Chapter 2. Let's just take a moment to review some of the key takeaways from this particular episode. Dr. Wang, let's start with you.
Painful skin phototoxicity is the most common manifestation of EPP, but symptoms leading to phototoxic reactions can vary.
EPP often has a significant negative impact on overall quality of life as patients avoid visible light to prevent debilitating symptoms.
Adults and adolescents with EPP experience a variety of psychosocial stressors.
Each individual's experience with EPP is unique, with varying burdens that evolve over time.
The physical and psychosocial impact of EPP extends to families and caregivers.
And this will conclude Chapter 2 of our video series. Special thanks to our presenters, Dr. Gail Ross and Dr. Bruce Wang. And thanks to you for tuning in to understanding patient health and psychosocial burdens of EPP. We'd also like to thank Disc Medicine for their sponsorship of this broadcast, and certainly hope that you can join us for the next episode in this series on EPP.